What is SeraSeal? SeraSeal is an innovative primary hemostatic agent that is designed to stop bleeding on contact and within seconds for arterial hemorrhages. It is comprised of agar and bovine factor proteins 2A, 7A, 9A, and 10A, and acts as a catalyst in the clot formation process. This patented single-component system can tackle any bleeding situation with the potential to save many lives. When seconds count, SeraSeal can make the difference between life and death. The first stage of trauma leads to hemorrhage and inflammation. Hemorrhages lead to shock and resuscitation. And finally, all four adverse events: hemorrhage, inflammation, shock, resuscitation, on their own, all lead to coagulopathy. Coagulopathy has the potential to lead to hemorrhage, only to continue the cycle of hemorrhage. Death is the result if hemorrhage is not arrested. SeraSeal, when used with other surgical modalities, is able to effectively control bleeding in level 3 and level 4 type hemorrhages in seconds, and can be used in emergency and trauma cases. Clinical studies and clinical use have demonstrated SeraSeal's unique formulation to be effective in a wide range of coagulopathies. When SeraSeal is applied to a wound, it does not create inflammation or damage to the tissues, allowing the wound healing to occur sooner. A one-component hemostatic agent, SeraSeal requires no mixing or preparation and is available in multiple delivery systems to administer any wound to any part of the body. By controlling bleeding, the need for blood transfusions is substantially reduced, thereby reducing risk and cost to the patient. Additional cost savings are realized through the use of SeraSeal by reducing surgical time, where in some cases the savings is as much as 50%, and shorter hospital stays. How SeraSeal works. There are two distinct pathways for fibrin clot formation: the extrinsic and intrinsic pathways. The vitamin K factors in SeraSeal support both clotting pathways to form a fibrin clot in seconds instead of minutes. The fibrin clot adheres to the initial agar barrier, reinforcing the physical sealant. The SeraSeal clotting cascade. The effect on the coagulation cascade system is on blood outside the injured blood vessel and not on the intravascular system. The extrinsic pathway. The intrinsic pathway, where both the extrinsic and intrinsic pathways share the common pathway to form a fibrin clot. SeraSeal catalyzes these specific factors: Factor 7, Factor 9, Factor 10, and Factor 2. Factor 5 is activated by the release of thromboplastin from the injured blood vessel, not from SeraSeal, and before SeraSeal is applied to the wound. It is SeraSeal's ability to bridge any point in the normal coagulation cascade system that is inhibited by anticoagulation medication, such as heparin or warfarin, or a factor deficiency. Agar in SeraSeal will cross-link with the ions of platelet phospholipids and cations from amine groups in fibrinogen, fibrin monomers, and tissue proteins to form a platelet barrier over the wound. In addition, platelet inhibitors do not bind to the phospholipids on the platelet surface. Therefore, agar is effective in the presence of platelet inhibitors. The effectiveness of SeraSeal. In this graph of normal patients, the graph is broken into 4 sections: levels 1, 2, 3, and 4. Level 1. 15% blood loss, 1 to 750 ml in 3 minutes. Level 2. 15 to 30% blood loss, 750 to 1500 ml in 3 minutes. Level 3. 30 to 40% total blood loss volume, 1500 to 2000 ml within 3 minutes. And level 4, greater than 40% total blood volume loss, over 2000 ml in less than 3 minutes. The upper limit of clotting time is 10 minutes. The effectiveness of SeraSeal is shown in red: fibrin glues in green, and collagen fibrin patch in orange. These are used to distinguish the three different hemostatic agents. The time to hemostasis for SeraSeal was 1 to 3 seconds, fibrin glues 1 to 3 minutes, and collagen patch 1 to 5 minutes. SeraSeal arrested the bleed in 1 to 3 seconds, fibrin glues in 5 to 10 minutes, and the collagen patch failed to stop the bleed within 10 minutes. In Level 3, SeraSeal clotting time was less than 10 seconds, while fibrin glues failed with a greater than 10-minute clotting time. And in Level 4, SeraSeal achieved hemostasis in less than 30 seconds. In this graph, heparin and Coumadin patients. In Level 1, SeraSeal clotting time was 1 to 3 seconds, while fibrin glues clotting time was 5 to 10 minutes. It should be noted collagen patches are ineffective to arrest the bleed when a patient is on anticoagulant medication. For Level 2 bleeds, SeraSeal achieved hemostasis in 1 to 5 seconds, while fibrin glues failed to clot the blood within 10 minutes. For Levels 3 and 4, SeraSeal clotting time was less than 30 seconds and less than 60 seconds, respectively. In this SeraSeal technical review, in a clinical study, SeraSeal was compared to cauterization in Level 2 through Level 4 type hemorrhages. 238 patients were enrolled, 214 adults and 24 children, ages 20 days through 92 years, an age mean of 50.1 years. Out of the 238 patients enrolled, 26 were on heparin therapy at a mean dosage of 279 units per kilogram. The following is from SeraSeal technical data sheets from the 238 patient clinical study, where SeraSeal was compared to cauterization as a primary hemostatic agent in 6 surgical departments: cardiovascular, neurosurgery, head and neck, orthopedics, general surgery, and gynecology. Each surgical department lists the type of surgical procedures performed, mean SeraSeal dosage, time to hemostasis, and blood loss of SeraSeal versus cauterization. In the cardiovascular department, procedures included aortic valve replacement, mitral valve replacement, aortocoronary bypass, heart transplant, carotid endarterectomy, femoral popliteal, lobectomy, aneurysmectomy, iliac artery replacement. The mean SeraSeal dosage was 5,000 IU, or 1.7 ml, was used. The mean time to hemostasis was 1.05 minutes for SeraSeal versus 9.31 minutes for cauterization. It is noteworthy that time to hemostasis was the mean total time of all the individual bleeds throughout the surgery. The reason why time to hemostasis was faster for SeraSeal than cauterization is with cauterization, each individual bleed in a wound requires cauterization, while in a SeraSeal treated wound, all of the individual bleeds in that wound are arrested at the same time. For SeraSeal, the mean blood loss was 351 ml versus 747 ml for cauterization. In the neurosurgical department, 2 types of surgical procedures were performed: laminectomy and craniotomy. The mean SeraSeal dosage was 3,818 units, or 1.3 ml, was used. A mean hemostasis time of 1 minute for SeraSeal versus 46 minutes for cauterization. Blood loss for SeraSeal was 235 ml versus 709 ml for cauterization. In the head and neck surgical department, the following surgical procedures were performed: thyroidectomy, parotidectomy, radical cervical resection, parieto-occipital resection, oral mucosa, maxillary sinus cancer. The mean SeraSeal dosage was 4,456 IU, or 1.5 ml, was used. SeraSeal achieved a mean hemostasis time of 2 minutes versus nearly 48 minutes for cauterization. Blood loss was 10 ml versus 183 ml for SeraSeal and cauterization, respectively. Procedures in the orthopedic department were amputation, femoral osteomyelitis, hip disarticulation, subcondylar hemimandibulectomy. The mean SeraSeal dosage was 9,643 IU, or 3.2 ml was used. The mean time to hemostasis for SeraSeal was 4.43 minutes versus 54 minutes for cauterization. Blood loss was 80 ml versus 1,180 ml for cauterization, 15 times more than SeraSeal. 9 surgical procedures were performed in the general surgery department: liver, spleen, pancreas, gastrectomy, cholecystectomy, portocaval shunt PTFE graft, mesenteric caval bypass PTFE graft, appendectomy, Whipple. The mean SeraSeal dosage was 3,833 IU, or 1.3 ml was used. SeraSeal mean time to hemostasis was 1.7 minutes versus 34.5 minutes for cauterization. The mean blood loss was 190 ml for SeraSeal and 578 ml for cauterization. In the gynecology department, 2 types of surgeries were performed: mastectomy and ruptured ovarian cyst. The mean SeraSeal dosage was 3,000 IU, or 1 ml. SeraSeal mean time to hemostasis was 0.7 minutes versus 32 minutes for cauterization. Blood loss was 85 ml versus 275 ml for SeraSeal and cauterization, respectively. In this graph, the mean time to hemostasis and blood loss are summarized for each surgical department of SeraSeal versus cauterization. The overall time to hemostasis of SeraSeal was 21 times faster than cauterization, and SeraSeal reduced blood loss by 69%. In the SeraSeal group of normal patients, the time to hemostasis was 1.56 minutes for adults and 1.74 minutes for the pediatric patients, versus 29 minutes for adults and 51.45 minutes for children in the cauterization group. The blood loss mean was 200 ml for adults and 73 ml for pediatrics, versus 600 ml and 329 ml for the adult and pediatric patients, respectively. In the heparin patients, SeraSeal achieved hemostasis in 45 seconds versus 10.42 minutes in the cauterization group, nearly 14 times faster. Blood loss was 370 ml versus 766 ml for SeraSeal and cauterization, respectively. Here we have a summary of the 238-patient clinical study of SeraSeal versus cauterization in 6 surgical departments and 32 surgical procedures as a primary hemostatic agent. In normal patients, the adult mean time to hemostasis was 1.56 minutes for SeraSeal versus 28.74 minutes for cauterization. The adult mean blood loss in the SeraSeal group was 200.6 ml versus 600.08 ml for cauterization, 3 times the blood loss for cauterization versus SeraSeal. The mean blood loss for the SeraSeal pediatric patients was 72.92 ml, compared to 329.16 ml in the cauterization group, 4.5 times the amount of blood loss. The heparin dosage range was 62 to 400 units per kilogram. With SeraSeal versus cauterization with heparinized patients, the mean time to hemostasis was 0.73 minutes versus 10.42 minutes, respectively. And the mean blood loss was 370 ml for SeraSeal and 766.67 ml in the cauterization group. There are multifaceted cost savings to using SeraSeal. Faster time to hemostasis reduces the cost of the surgical theater and the amount of anesthetic medication administered during surgery. A 69% reduction in blood transfusions. SeraSeal is non-inflammatory and does not destroy tissue. Thereby, pain medication is reduced. A significant reduction of blood loss during surgery would shorten or eliminate the need of an ICU stay. Wounds heal faster with SeraSeal, since there is no tissue loss, shorting hospital stays. The SeraSeal advantages are many. SeraSeal is a primary hemostatic agent. Hemostasis occurs in seconds. SeraSeal is effective in all forms of coagulopathy. SeraSeal has multiple delivery systems. There is no preparation of SeraSeal. SeraSeal can be used immediately. SeraSeal can be used in emergency and trauma cases. SeraSeal reduces surgical time, results in less blood loss. With SeraSeal, there is no loss of tissue or adhesions. Healing is promoted. SeraSeal can be used outside of the clinical setting. SeraSeal can undergo freeze-thaw cycles without loss of activity, and SeraSeal results in substantial cost savings.